Imagine having a toothache, a sharp throbbing pain, a pain deep inside your jaw. Every single heartbeat hurts. Every single pulse throbs. Every pulse sends fire, shooting up your skull, shooting into your eyes. Chewing food feels impossible. Drinking water brings agony. Cold air triggers spasms. Warm soup triggers agony. Sleeping becomes totally impossible. You hold your cheek. Tears roll down face. You groan in bed, rocking back and forth. Today you see dentist. You sit in comfort. Soft leather dental chair. Air conditioning keeps cool. You get a shot, a tiny painless needle, a quick numbing injection. Local anesthesia takes effect. You feel zero pain. The bad tooth vanishes. Now, travel back time. 700 years ago, the brutal Middle Ages, an era of darkness, an era of filth, before modern medical science, before painkillers ever existed, before dental hygiene started, before toothbrushes were invented. If your tooth rotted, there were no pills, no gentle numbing gels, no clean dental clinics, only terrifying dark remedies and brutal blacksmith tools. Welcome to medieval dentistry, where the cure hurt worse than disease, pure unadulterated human agony. Back in medieval times, people believed something bizarre. They did not know about bacteria. They never heard germs. Doctors thought tiny worms, tiny invisible tooth worms, lived inside human teeth, boring deep through enamel, gnawing on sensitive nerves, wiggling inside your jaw, breeding inside the bone, laying eggs inside cavities, causing all the agony. So how did they cure it? They tried smoking worms, smoking them out completely, pouring burning hot wax directly into open cavities, or blowing sulfur smoke, hot toxic sulfur smoke into infected mouths, hoping the worms choked, hoping the worms died, or packing rotten cavities with crushed poisonous henbane, or sizzling boiled oil, pouring burning corrosive acid, pouring acid into teeth, applying hot iron rods, red hot metal tips directly on open nerves, burning the nerve alive. Of course it failed. The smoke burned gums, the hot wax scorched, the tooth kept rotting, nerves kept dying slowly, the excruciating pain grew, spreading into the cheek, swelling up the eye, swelling up the neck, until only one final option remained: total brute force extraction, ripping the tooth out, crushing it from bone. You did not visit a trained doctor. Surgeons thought pulling teeth was beneath their dignity. Far too messy work, far too bloody task, too lowly for doctors. So who pulled teeth? The local town barber, or the heavy blacksmith. Men with massive forearms, men used to brute force, known as tooth drawers, traveling from town to town, setting up filthy booths. They worked in streets, out in public squares, surrounded by shouting crowds, because medieval tooth extraction was loud street entertainment, a traveling circus act. Musicians played loud drums, trumpets blew sharp notes, bells rang out constantly, loud bagpipes squealed loudly, not to celebrate you, not for your entertainment, to drown out screams, ear-piercing screams of agony, so other paying customers waiting in long line would not run away. You sit on stool, a rough wooden chair in middle of square. Two strong men grab, they pin your shoulders, they pin your head, holding your neck tight, kneeling on your chest, preventing you from kicking, preventing you from escaping. You open your mouth, your heart pounds fast, terror floods your veins. The tooth drawer steps. He steps up close, wearing dirty leather clothes stained with old blood. He holds no scalpel, he holds heavy iron, a crude iron pincer, rusted blacksmith iron pliers, or a medieval pelican, a sharp clawed lever designed to pry bone like a heavy crowbar. No clean sterile tools, no washing between patients. Dried blood on iron, rotten flesh on steel, rust covering the blades, the cold metal clamps down on tooth. The iron bites deep into infected gums, crushing against tender roots. The barber plants feet, bracing against your chest. He pulls with force, pure violent human strength. He twists the iron. Cracking sounds echo inside your skull. The tooth roots tear, ripping away from bone. Your jawbone bends, bone splinters break off, blood fills your throat, choking on warm blood. Patients scream in shock, screaming until lungs tear, passing out cold instantly, waking up seconds later to feel another pull, because moving with force carried massive, dangerous risks. The tools often slip, crushing neighboring healthy teeth, slicing open tongue flesh, tearing open the cheek, or snapping the jawbone, breaking the entire jaw, fracturing lower facial bones, leaving patients horribly disfigured, permanently scarred for life, unable to chew again, living in endless deformity. If you survived extraction, the true nightmare began, because bacteria thrived everywhere. Unwashed, rusty metal tools pushed deep into wounds. Deadly infections spread fast. Sepsis entered the bloodstream. Cheeks swelled with pus. Infections reached the brain. Infection reached the throat, blocking the airway completely, causing agonizing slow suffocation. Fevers raged for days. Nearly 10% died from tooth infections. A simple rotten molar was a death sentence, a painful slow demise, an agonizing feverish delirium. Look at modern dentistry. A sterile clean chair, bright soft overhead lights, a tiny painless needle, gentle numbing that lasts, high-tech precision tools, water-cooled dental drills. You walk out smiling. No screams in streets, no drums drowning agony, no rusted blacksmith pincers, no violent bone livers, no dirty street barbers. Modern medicine feels peaceful, pure comfort and safety, built on centuries of horrific torture, centuries of screaming fear, centuries of broken jaws, generations of suffering people. Think about that history next time you sit in a dentist chair, because 7 centuries ago, a simple bad tooth was pure hell on, was literal horror on earth.